Welcome to my presentation. This is Colleen, and I am presenting the topic Safety Essentials for Mobilizing Neurological Patients in Pecha Kucha format for assignment number 5 for PIDP 3240. There are many different signs to watch out for before mobilization of an acute patient with a neurological condition. Vital signs should be assessed before mobilization, and then other symptoms should be monitored throughout, such as pain, dizziness, fatigue, nausea, and cognitive status. The first vital sign is heart rate. The normal heart rate for an adult is between 60 to 85 beats per minute. You can measure the pulse by putting your index and middle finger over the radial artery as indicated in the picture. Heart rate is most accurately measured by counting the beats over a 60-second period. If you measure the heart rate and the heart rate is low, such as less than 40 beats per minute, you should not mobilize the patient. If heart rate is above 130 beats per minute, then you should also not mobilize the patient, and report your findings to the nurse or doctor. The second vital sign is blood pressure. The normal value is 120/80 millimeters of mercury. The top number represents the systolic pressure, which is when the cardiac muscle is contracting. The bottom number represents the diastolic pressure, which is when the cardiac muscle is relaxing. Blood pressure is measured by placing a blood pressure cuff around the upper arm, with the arrow on the cuff placed over the brachial artery. Have the arm supported on a table and advise the patient not to talk. Press the button on a blood pressure machine and wait for the reading. When you should consider not mobilizing the patient is when the values are greater than 150 millimeters of mercury systolic, or when there is a drop in blood pressure more than 10 millimeters of mercury systolic. These values vary a little depending on the research and the person. The third vital sign is respiratory rate, and the normal adult respiratory rate is 12 to 16 breaths per minute. This is done by counting the number of cycles of breath a patient takes per minute by observing the chest rising up and down. One cycle is a breath in and out. Do not mobilize a patient when the respiratory rate is less than 10, which could indicate an airflow obstruction to the lungs. If the respiratory rate is greater than 20 breaths per minute, this could indicate a problem with the lungs, such as pneumonia or asthma. Now known as the fifth vital sign, it is best practice to check oxygen saturation, which is a measure of how much oxygen is in the blood. The normal value is 95 to 100% in a healthy individual. It is measured by putting a device called an oximeter on the patient's finger. If you notice that the patients have a bluish tinge to the skin, they may be experiencing cyanosis, which means that there is not enough oxygen in the blood. If the oxygen saturation is below 90%, the patient may not be getting enough oxygen to their tissues and have trouble breathing, and you should stop mobilizing. The last vital sign is temperature. Normally the temperature is taken by the nurse, but it is still important to know the normal value, which is 37 degrees Celsius. If the temperature is above 38 degrees Celsius, this could indicate that a patient has a fever or a potential infection brewing. If a patient is in a lot of pain, they're not going to tolerate mobilization. Ask what their pain level is out of a score of 0 to 10, 10 being the worst pain. If a patient states 6 out of 10 or greater, they will probably not tolerate much activity. Talk to the nurse about pain medication. Another sign to watch out for is dizziness. Before getting a patient up, ask if they are dizzy or lightheaded. Ensure that the patient sits up slowly and sits at the edge of the bed for at least 1 minute before standing up. If they are still dizzy, their blood pressure may need to be checked. Ask the patient if they are experiencing any nausea. If so, it might be not a very good idea to get the patient up. Check with the nurse to see if any nausea medication has been given. If the patient is willing to mobilize, bring a bowl along just in case the patient needs to vomit. Fatigue is another symptom. Ask the patient if they are tired. Are they able to keep their eyes open? Are their eyelids closing while you're talking to them? Are their shoulders sagging? Are they yawning consistently? This may not be a good time to get them up. Cognition is another factor. Is the patient following instructions? Ask a few key questions such as their name, where they are, and the date. Check if they can follow simple instructions such as, can you lift your arms or point to your nose? If they cannot follow, it may be unsafe to mobilize. How is the patient's balance? Can they sit tall without moving? Can they safely reach for an object in sitting? If they have good sit balance, then check their standing balance. Can they stand or take a step without swaying, or will they need a walking aid? In review, remember first to check the vital signs: heart rate, blood pressure, respiratory rate, and temperature. Also check oxygen saturation. Are the values within normal limits? If not, then check with a nurse or doctor and don't mobilize until these signs are stable. In review, if the patient is dizzy, nauseous, or is reporting a lot of pain, then you should not mobilize the patient. If the patient is overly fatigued, not following instructions, or has poor balance, then the patient should not be mobilized until further reassessment. There are many signs to watch out for when mobilizing a patient with a neurological condition. First, ensure vitals are stable, and then assess the patient for all other signs and symptoms. Take the time to learn the signs and the normal and abnormal values, and you will be best prepared to handle any situation. Thank you for listening.